problem is that general practice services in Halton are not sustainable. The purpose was to get, by January 2015, an agreed strategy, and agreed being the important word there, to deliver sustainable general practice services in Halton. We spent quite a bit of time, as you'll see, developing that shared understanding of the problem. And there will still be people who don't understand the problem. There will still be people who don't say we need to change or have different views. But it enabled us to find a critical mass of people to work with. Then we started moving towards that solution to create that strategy. And then we're into the realms of execution now, and we've got an implementation plan with outcomes, because again the NHS has a real history of not having implementation and outcome plans to monitor and measure against. In terms of implementation, we established that sense of urgency with that lot of discussion around the wolf at the door. We made sure there was a strong guiding coalition across those practices, across our key clinical leaders and across our key practice managers, as well as ourselves as senior officers and leaders in the NHS. We had the evidence-based narrative, which was developed. It was developed rather than told. It was actually developed with people. So that work earlier around that root cause analysis was developed with one of the earlier workshop groups we had about, well, what are the problems? Does what is in a call to action for general practice, does that reflect your world? Can I understand your world a bit? Is this what you're facing? And then from that you built some local narrative around that. NHS IQ then came in very much as an accelerator. It empowered people to act. It gave us that impetus for change. It gave us somebody who had lots of tools in their box to help that change happen, and could deploy them at appropriate points. Even when you had people who challenged the tool necessarily, there was still something to work with. And then we set up lots of focused work streams. There's one on care homes, there's one on hypertension. So actually to make it real for some of our partners, particularly for the clinicians who wanted to do something as well. Again, dedicated resource of programme management, brought somebody in for that. And again, the message, come with us. Not I'm leading this, but come with us, help us. Knowledge, expertise and experience, and actually that ability to step back and say, well, have you thought about it this way? Because we do all get entrenched in that passion of where we are and of our own individual place. And that therefore was brought about that enabling and facilitative approach. NHS IQ don't do the actual work for you, but they enable the work to happen. So they actually are challenging in setting timeframes with you. They're challenging in terms of making sure people come back with something and keep the programme itself running. And therefore the ownership remains with all those people in that room, or actually not just in that room on the day, but in all the things that are happening outside, and all the other working groups that are getting on. The change model and associated tools are absolutely fabulous, but perhaps I'm a bit of a change geek, leadership geek type of person, but I just think the change model just sums it up. It was great to get it on as floor tiles and get people to stand in the bit that they felt was most applicable to them, but then to challenge will say, well, why aren't you in that bit? I think you could do really well in terms of leadership for change, for example. And the large-scale change model itself, driver diagrams, it all helped the flow as we went on. So learning, change programs are systemic as well as systematic. The systematic bit I think is really important to have that good, if you like, transactional process driving it forward, but the most important thing is actually it's about the system you work in and making sure that you do so in an open way. Understanding the why before the how. I think also being candid. It was quite a big thing to say things are wrong, this isn't working, we need to do something differently, we need to be better. Obviously any change process program generates fear, but a really powerful emotion to counter fear with is hope. So we countered the anxiety and negativity, as I said, by seeking those positive solutions, by being clear this was about benefits for patients, benefits for the workforce, benefits for the local population and how we interact. Create the incentives for change with people and establish that environment, because we know coercion doesn't work. I've spent a lot of time searching out the discontented, the disconsolate, the disappointed, find out why, understand their world, try and work with them. I'm not saying we're there in Halton. I'm not saying every single GP, practice nurse, etc. is signed up, but we have enough. We have enough to move with us. And informed people don't fear change. If they understand what you're trying to do, they will start to support it, because you can have those discussions with them. And it is the movement for change. We've got lots of people working with us now. And finally, this is again something that Feuda quotes. It's from an American basketball coach called John Wooden. He had 11 seasons in which he won with this particular college, I think it was, the basketball title, inter-college basketball title. Every year, had a different team every year. And the first thing he said to these guys, you're good, but are you good enough to get better? And that's the question we're asking ourselves now as part of this programme.